I will dive in a little bit deeper to talk about what qualitative research can look like. As Ekaterina said, this is largely about getting a really deep picture of what's going on with your solution or in your context. And within qualitative research, there are a number of different designs as well as some different methods that can be used. Designs are overarching frameworks that guide how your inquiry is designed. So examples of this in qualitative research are case studies, grounded theory, ethnography, phenomenology, and narrative approaches. We're not going to quiz you on all of these different designs, but we're going to just go through some examples just to give you a sense of the range of questions that can be addressed with qualitative research. The methods that are commonly used for qualitative research are interviews, focus group discussions, and observations, and those can be applied within any of these overarching designs or approaches. A case study approach in qualitative research is an in-depth exploration of a single case, or if you want to do some comparisons, you might have multiple cases. And the idea is to understand how and why an intervention works or doesn't work in a real-world context. So an example of a question that could be answered with a case study might be, how did the implementation of a program unfold in a particular sub-county? And what contextual factors supported or hindered its success. So here you're really looking for a 360-degree view of a specific case and context. Another approach to within qualitative research is grounded theory, which is about generating new theories directly from data that you collect and analyze. So an example of this could be trying to understand what factors influence teachers' instructional decision making. So after whatever methods you decide to use to get the data, whether it's focus group discussions, interviews, you would be able to list out the different kinds of factors that influence the decisions that teachers make. Another approach to qualitative research is phenomenology, which is all about understanding individuals' lived experiences and the meanings that people attach to those experiences. So an example of this would be asking how primary school teachers experience and make sense of participating in remote coaching during school closures. So here you're really looking at that internal experience that people are having as they're participating in something. Another approach within qualitative research is ethnography, which is a really immersive approach that focuses on cultural practices, beliefs, and norms. This usually involves pretty long-term field work to really get that full picture of what's going on within the community. So an example of a question that could be answered through ethnography is, what are the community norms around parent involvement in learning? And how do these norms shape participation in home-based literacy activities in a particular context? The last broad approach within qualitative research is a narrative approach, which focuses on collecting and interpreting personal stories. And it can help you understand how people make meaning of their experiences over time. So within narrative research, you have this element of time and how people tell a story about their experiences over time. So an example could be what stories adolescent girls tell about their journeys through secondary school. And then within that, how did a mentoring program shape their decisions? So the common thread through all of these research questions and approaches is getting a really in-depth view of all of the factors that are going on in your context and around your solution, whether it's focusing on relationships within communities, internal experiences, how people's experiences change over time, or comparing different contexts. That's where you can get into using specific approaches to get the information you need. But the big picture is by using the different methods, interviews, focus group discussions, and observations, you can answer these very in-depth questions. Then focusing in on the specific methods, three broad categories are interviews, focus group discussions, and observations. Interviews are one-on-one conversations. They range from very structured, where you're going through a lot of questions, or less structured, where you have a few questions to start out with, but the conversation can really follow the person that you're interviewing. These are really great about giving you immediate insights directly from your key stakeholders or your target population. A limitation is that your participants might not represent your whole target population. It can also be quite time and resource intensive, both for the researchers and for participants. And it can really depend on the interviewer's skills to make people feel comfortable and willing to share about their experiences. Focus group discussions are similar, but instead of being one-on-one conversation, they're small ones, just as with at one time. So compared to interviews where you're just getting one perspective at a time, this can be a little bit more efficient. And it also encourages interaction and reflection. So one participant might say something that triggers an idea in someone else. And that can lead to new and rich insights. As with interviews, your participants might not always be representative of your whole population. There's a risk that some dominant voices might overshadow others, or that people might not be comfortable sharing really personal things in front of a group. As with interviews, it really does require skilled facilitation to get you the insights that are most helpful. Observations are a third type of method. They can be recorded or live, and could be of participants implementing your intervention, using your product. And an advantage here is that you can see people's actual behavior as opposed to just what they report. And you can get nonverbal and contextual factors as well as information that people are just telling you, which is what you get in interviews and focus groups. Again, as with interviews and focus groups, your participants might not be representative of your whole target population, and sometimes being observed can influence people's behavior. The last question to consider when you're thinking about doing an observation is whether you need and can actually use qualitative observation data. If not, then it might make sense to use for observations to collect them in a more quantitative way using something like a checklist. But if you do have the capacity to use that qualitative data, you can get really rich observations this way. Now I'll pass it back over to Ekaterina to talk about quantitative research designs and methods.
Thank you. So quantitative designs and methods do exist, so we can do something very quickly, and we can get quite meaningful data in large volumes. We can get fairly representative information from across our people we work with, and it allows us to understand how certain things connect to another in statistical relationship patterns or particular links. There are correlational methods and there are experimental or quasi-experimental methods. One allows us to establish the relationship, others really allows us to establish some sort of causations. Depends on the method and design. The key tools that we use for the quantitative methods are surveys, questionnaires, generally documents, structured mathematical or quantitative documents, and structured observations. These surveys allow us to collect structured data from any individuals we work with and allow us to collect data on a range from minimal to maximum. It's easy. It's really super easy to implement. It's easy to collect. Usually people are open to give a little bit of their time to share their opinion and allows us to reach quite a substantial amount of people. It's not necessarily always meaningful, or people not always honest, or they want to be better than they are, or they want you to think that they're better than they are. So it's not necessarily very representative. And of course, there is a problem of depth. There are documents that are records that may be reflective of the attendance or test scores or any other measures that's already implemented in place. We can get easily to access to them. It's cost effective. And it allows us to observe the trends over time, how things improved or changed over some period of time. Sometimes we may not necessarily be able to reach those, or they may be not very closely aligned to what we want to know or questions we have to ask. And of course, they may be inconsistent or incomplete in their nature, in the way they were felt or stored. And finally, structured observations. Very often there are structured observations implemented across schools or classrooms and allow us to observe certain types of behavior and allows us to understand how well our interventions or our solutions being implemented on the ground. So we can learn a little bit more about fidelity and usage in addition to surveys or rich stories that we're gathering from the interviews. The observations are time consuming. They not often very objective because they could very much relate on they rest on the opinion of the observer. And there is in order to standardize them, it may require some certain efforts and some certain resources. And then let's talk a little bit more about the design. So correlational design, as you know, correlation doesn't mean causation, but it allows us to ensure that things exist in the nature. It allows us to observe things. So for instance, we can see whether there are trends or patterns on the positive patterns related to the intervention pre and post. We measure something once at the baseline and we measure something after. And that's a very reasonable step for new interventions to do before we dive into any sort of experimental or quasi-experimental methods. And of course, doesn't indicate causation and may be attributed to something else, not just to the intervention that has been implemented, but nevertheless, it might be a very helpful indicator. Two-group design allows you to compare two groups, but through the single point of comparison, meaning that sometimes it may lack the baseline and we don't know where our participants were before they started, or how did they felt about the intervention and so on. So we don't know also what changed over time and where there was increase or decrease due to our intervention. And then when we talk about quasi-experimental methods, we can consider multiple things. We can consider difference in differences, RCT, we all know, randomized controlled trials, and A/B testing. Difference in differences is very similar to two-group design, but this one allow us to have the baseline. That's when we considered very carefully the group that had intervention and group that hadn't had intervention and also had baseline and end line, or maybe sometimes even midline. And but we didn't assign participants in those two groups randomly, and that as a result may cause particular limitations. Randomized controlled trials considered the golden standard. Whether it's always a good idea to have randomized controlled trial or implement a randomized controlled trial is a different matter. But when it's relevant, when we know that our intervention is well established and we have decent amount of participants and we know that we're not going to lose participants as we progress through the intervention, randomized controlled trial is the solid way of us to understand whether we can attribute the changes among our sample or our participants to the intervention or to solution we offer to them. And finally, A/B testing. That's useful solution or useful method that's typically used in a tech or could be used in the assessment and comparison of physical interventions as well. But it's really when we're trying to figure out how two different groups randomly assigned again, engaging with a certain, let's say, feature or engaging with a certain means of delivery, and how does that engagement affect the learning outcomes or cost or both. And then, of course, we don't really compare it to baseline, so we don't really know whether it's still better than nothing. But nevertheless, it's a helpful way to understand what could be the most efficient way to deliver our interventions. And Once you've done that, once you've collected your data, whether it was qualitative, quantitative, or mixed, when you gathered a lot of insights and you analyze the data and you start to know that you start to understand your interventions or your solutions better, there are multiple ways how you can adapt those insights. How can you adapt your solution or even your organization, right? In particular, it's really helpful to communicate to the stakeholders and adjust their views on the solution or propose changes potentially, or even work with share those insights within the team. That could be really empowering in order to motivate them to enhance the program or make iterations. It allows us to accurately measure our success because we can move the benchmarks in accordance to our new insights and knowledge. We can make a better decisions about how to scale, how to implement next steps, how to develop new features, how to work with new target audience, and so on. We can make better strategic decisions in terms of what is right for us as an organization, but also what's right for our intervention and for what could be right for our stakeholders and recipients of our intervention. We can tell a better story and we can have a more accurate story to tell. We develop as we learn, we develop, and as we develop, we learn. And of course, we also have the better clarity in terms of the impact. And it's not always about randomized control trials. Sometimes the smaller studies may be very informative and very meaningful for us to understand how to achieve the desired impact that we hope to achieve and that we are drafted in our theory of change. And of course, the improvement of delivery. We cannot achieve the impact without knowing that our intervention works, for whom it works, and how specifically it works. So understanding and adapting as we understand more about the context, the world around us, our participants, and our intervention is really key for the development, delivery, and for scaling.
Now we will pass it over to Simon to talk us through a little bit about IRUI as an organization, as well as how they've been able to integrate research into their work and apply what they've learned from the research to improve their solution. Go ahead, Simon.
Well, thank you so much, everyone, and Sarah for this opportunity to present our work as IRUI. IRUI is a non-governmental organization that is committed to improving the learning outcomes, the entire education within the low-income communities. So for this specific project, we understand that in many low-income communities within which we serve, many children miss out on the adequate care needed, nurturing care needed to support their early learning, especially in their first years. So we know that if they are not well nurtured in the very early years, by the time they start school, they're already behind. And if we don't intervene, the gap continues to grow. And therefore, we as an organization make early interventions to address that. So our vision for scale is to improve the development and learning outcomes of children aged 0 to 3 across 3 counties in Kenya. And we have a deliberate pathway to scale, where we have established that scaling through the social franchise model gives us the best shot to achieve that, and use of community-based implementation through establishing of centers of excellence and launching and onboarding caregiver champions to help us to drive that process, because in that way they ensure that the approach is well grounded within the community, and it also receives necessary support from the community itself. So we also understand that without data, we cannot actually achieve much, and therefore we apply data-driven approach to measure impact so that we may achieve the vision that we hope to achieve, that we plan to achieve. So in this process, we understand also collaboration with government is also important in terms of approving of the programs, also providing some resources such as training using their infrastructure that is really available to achieve cost effectiveness. So we employed a qualitative research method, as has been explained by Sarah, and we wanted to understand specific attributes of our main participants. For example, some of the research questions that we wanted to get a view of is understanding the current quality of care that is received within the communities. We also wanted to understand to what extent do these caregivers understand the nurturing care, whether they have any skills or knowledge relating to nurturing care. We also wanted to understand whether they practice learning or play, or whether they employ they use play materials, or whether they have a peer support group that supports that also ensures that they collaborate, and also generally having a feel of the challenges they face in the process of providing care for these children, and whether these challenges border on issues relating to economic conditions, emotional, as well as logistical aspects. The main reason for us applying the qualitative method was to sort of capture the context-specific insights that quantitative data will not really provide, because we wanted to understand through focus groups and interviews to understand their personal stories. And also there are some sensitive topics such as poverty, which may not directly be explained through a survey or any other quantitative data. So through qualitative approach, we believed that such topics would come out clearly in the process of gathering that data. We also wanted to co-create the program together, the program design together, because we understand that even though we have an idea of what we wanted to achieve with them, but we also wanted their input, because they're the ones that perform the work. They're the ones that understand their pain points, and we wanted to really have a deep understanding of how they felt, how their experiences, and some of the challenges they face, so that we can together co-create the program design. And lastly, we also wanted to gather a narrative evidence that would help us to complement and inform some quantitative impact data that we were planning to collect. Yeah, so as I said before, we used interviews and some form of focus groups. And the interviews took an average of 30 minutes, where the ERUI staff, members of staff, 5 of them were deployed in various locations and supported by the community leaders. We were able to then go to their homes, respective homes, and then sought to interview them. Of course, they had already been informed. We had already gotten their contacts through the community leadership, and then we then told them that we then booked sessions with them. So it was not a surprise when we went to their homes. They were welcoming and they knew exactly what we wanted. And it took an average of 30 minutes per participant. And as I said, we conducted them from homes. Yeah, the various communities we conducted in 5 sub-counties of Uasin Gishu County, and mostly in the slum areas. And these communities, therefore, are virtually similar in almost all aspects. So we didn't have a community that was substantially different from the other. And the participants were chosen based um, were new because it was a new project and it was a completely different kind of intervention there. So therefore, we wanted to have a clean slate. So we recruited new participants for this, and a total of 142 participants attended the interviews, even though for the focus groups, the number reduced to around 50 by where we had each staff member conducting the focus group had around 10. So 5 times 10, we had around a total of 50 participants for the focus groups, but for the interviews, we had 142. As I said before, we mobilize these participants through community leadership, and also the caregivers that we had been initially recruited from earlier also helps us to refer us to other caregivers whom we then approached, and they were very kind enough to accept our interventions. So the process of developing questions was very intentional because we wanted to, as I said before, we wanted to implement the nurturing care framework, and therefore the questions that we developed were anchored on the nurturing care framework. And also we wanted the questions to align with the community culture because we understand some of the dynamics within the community, and we wanted those questions to really align with what they are used to and what was relevant for them to actually uncover the needs that we wanted them to help us identify. So some of the examples of the questions that we had included them explaining or highlighting or taking us through how that typical day looked to them, so that with that explanation, it was easier for us to identify some of the gaps, some of the challenges, some of the connotations that we wanted to identify, and also others that we had not even thought of. Another question was about the activities that they conduct with the children and how they help the children to learn or play, and that also was very important for us to understand exactly what used to happen, what the form of learning they used to give the children, whether they used to initiate play or whether they actually employed play-based learning at all. Yeah, we also wanted to understand the challenges that they were facing in providing the care, because it was so important, because once we understand the challenges, then we can design a solution to that, not only from our side, but also, as I said before, with them. Also about nutrition, which is also a part of nurturing care component, we wanted to understand the nutrition, how they provide nutrition to the children under their care, whether in terms of how many meals they provide a day or within the time they have the children. We also wanted to understand the kind of foods they provided, whether it was balanced or not. And yeah, and for economic parts, we wanted to understand whether the caregiving the caregiving undertaking was the only source of the main source of income, and if it was so, we wanted to know whether it was sustaining them throughout the month. Yeah, how we analyze the data. So it was sort of informal, kind of, because before we went to the field and did the interviews, we had we had notebooks where we were to under each question we were to write the notes from the responses of the participants, and those notes will help us to then highlight whether there were common themes arising from the interviews, which then helped us to size the key findings. Before summarizing, of course, we had to do what we call thematic sorting, where we highlighted common themes directly in the notebooks, and so to help us to actually address those urgent needs. And these summaries were based on what caregivers needed most urgently. For example, identified that they lacked the knowledge in the nurturing care. Most of them had not attended any form of training on nurturing care or ways to really care for the children. So we identified that the training or capacity building in the nurturing care components was the most urgent for that moment. It was also based on the where our support would have the most or immediate impact. For example, we knew that by employing peer support and also helping them to make low-cost materials would have the most immediate impact. So the key insights from the entire process was about, we discovered that around 68% did not have any knowledge on play-based learning, which is one of the 5 components of the nurturing care framework. And we also realized that around 86% of the caregivers earned 10,000 or less from their childcare facilities from their business. And also 90% have been had never attended any economic empowerment program before. And that was significant for us because we understood that by helping them get the skills, business skills, and that will help them run their childcare facilities properly, they will then in the end support the children to improve on their child development outcomes. And then on nutrition, we realized that 3 food groups that most of these childcare providers provided 3 food groups as opposed to the recommended 4 food groups given that were needed to be given to the children. So how did these insights and the entire process influence our program? Of course, the main reason we wanted to gather this information was to co-create or co-design a solution for them. And therefore, we deliberately used the information or the data received from the process to make some adjustments to the program. For example, we introduced practical hands-on caregiving training, which was not there before, because initially before this, we used to do a lot of training without actually using, without employing practical and hands-on training. And also we decided to adapt the training that would be accessible for both those who had some formal training and those who did not have any formal education. This was realized through especially for the interviews and focus groups, where we asked them to what level do they get at reach in terms of education, formal education. And then we, as I said before, also we integrated workshops on material development. This was informed by, of course, the sustainability of the program. It is not sustainable to buy these play materials, and it was necessary that we build their capacity on low cost material development using locally available materials. And then we also launched a caregiver champion to lead peer learning groups, because we realized that most of these caregivers didn't know each other. They did not have any form of interaction. Most of them were operating in silos. And for us to create a network of caregivers who have one thing in common, we decided to introduce the caregiver champions who are leading, as we speak now, who are leading peer learning groups. Each caregiver champion is handling 10 caregivers, which has proved to be very significant for us in terms of also trying to reduce the time for the staff. Initially, we were using staff members to conduct these sessions, but now we have built the capacity of caregiver champions, and they are leading that process smoothly, albeit with some challenges which are expected, but so far, so good. And lastly, we wanted to also get feedbacks from the caregivers, and through these peer learning, peer groups, we have an additional feedback loop. So where we hold reflective sessions, when they're having these peer sessions, some staff members do attend them, and those reflection sessions help a lot in trying to refine the program, and also stories of change, which have also been very impactful. Yeah, so we realized that a lot of what we did worked well. For example, community trust and participation by using local facilitators and community champions worked really well by ensuring that trust is maintained, because people who are championing these are people that are deeply rooted within the community. And also informal interviews and focus groups discussions allowed us to capture stories and perceptions, which was key for us to co-design the program with them. And the assessment itself also deepened our own engagement with the caregivers, and also to build stronger relationships and trust, because our main, what sets us apart mostly is our community-rooted approach. And these assessments and these engagements helped us to really reinforce that. Of course, we realized later that we will have done some things differently. For example, we missed an opportunity to capture the responses and the entire sessions through digital tools, and therefore should we plan that going ahead we will be employing these digital tools, cheap digital tools that will help us to gather and also help us to analyze the data. And we needed also to organize follow-up feedback sessions to share our findings, which we did not do, but given another opportunity, of course, we will implement that.
Simon, thank you so much for walking us through your experience and sharing some things that you learned through the process. We'll open it up now for questions. If anyone has any questions related to Irui's overall work or the parts that Simon just shared, please feel free to share them in the chat or just unmute and share out.
Okay, may I proceed?
Yeah, please go ahead.
Thank you. I'm Steven. I'm part of the IRUI team. So I'm not here. I'm not asking a question now, but I'm just commenting on something or adding something. Yes, I just want to thank you for these sessions that you've been having. They are really good and educative. So as Simon has said that we used as focus groups, and one secret that I learned with this is that you must make the participants comfortable first before you start asking the questions, because we were coming to this field when you can say we were new to this field, so we didn't know much, and we didn't know how these caregivers or our participants were interacting, what they were doing. But we first built their trust, and we made them comfortable, and they were willing to share. The only thing that was challenging there, I can say, it's when formulating these questions, it's good to formulate them in a way that they are not too direct to their sensitive. Uh, yeah, like for example, there is something that someone was talking about poverty. We initially we had a question which was asking them how much they earn in a day, and some of them could lie to us because the friend has quoted a higher amount. Now this person doesn't want to be seen as if she's earning low or something like that. So it needs a lot of I don't know, I can call it wisdom, to formulate a question in a way that it will trigger them to give out the answers that you want. Then another thing, a trick, because I was involved in the field work, I conducted uh, these interviews. I did them. One thing that worked for us is that we practiced the questions before we went to the field, like internally in our office. We sat down there, and a team was acting like the participant, and one of us was asking the question. Then we practiced just to see how it will go when we go to the field. So those are some of the learnings that we got from that. So yeah, we welcome questions.
Thanks, Steve. Those are such helpful hands-on practical tips. Thanks for adding those.
For group number one, so question number one, we had the example of adapting from the learning from feedback, developing low-cost play materials and using recyclable resources to implement the intervention. Because I guess directly implementing it would have had sort of cost implications, being able to adapt it, thinking about other ways to develop the play materials that were being sort of recommended. And then question number two, in terms of looking at what was most meaningful to educators, caregivers, and ECD practitioners, we had an example of conducting key informant interviews where there was an emphasis on the need to engage faith-based actors because of their role in influencing parents and possibly undermining some of the practices that were being promoted, but also the need to have data on the perceptions of parents on informal caregiving, and it being important to have local community members doing the data collection and conducting the focus group discussions because they have a better knowledge of the context and have pre-established trust. And then the last question around what can feel like a burden There was discussion around currently there might be reliance on using hard copies, so using paper copies to collect data, but the need to sort of move towards more digital ways of collecting data, and that's happening because there are low cost, technology sort of solutions. So focusing on that because it saved time and so the manual job of analyzing and inputting data.
Thanks so much. Really appreciate you sharing those back with us. For the next group, Rebecca, I don't want to put you on the spot, but do you want to go through the points or I can?
Please do, but yeah, please do, because I think I was doing the most of the talking, so you might have more points than me. Okay, thank you.
Oh, feel free to jump in if I miss anything. Some things that we talked about were that surveys and focus group discussions can be really helpful ways to get information from a lot of people at once relatively efficiently, but that key informant interviews can also be really helpful if you need very in-depth information about a particular topic or a community. And that the longer you're in a community, the more likely you are to get information back that you're already familiar with, but that there are always going to be new opportunities to learn about your community every time you conduct research. Another point was that sometimes your target group might be really large, and as Group 1 mentioned, it can be really important to think about how you can integrate tech to make that more feasible. And then a last point is just thinking carefully about the literacy levels of the people that you are interested in learning from to make sure that the data collection methods you use are accessible to them. And anyone from Group 4 want to talk us through what you discussed?
Group 4, Corazon speaking. So on the first question, where we were dealing with the kinds of low cost and simple adaptations that have been made in response from the data insights and the informal feedback, we were able to realize that low cost play materials was an option that was sought, where the participants were encouraged and were able to make from locally available materials that have zero cost, they're able to make play items. That is to encourage play-based learning. We also saw that there was an introduction of reading materials, paragraph and story booklets, as well as use of non-face to face learning that helps in cutting considerably the training costs involved with face-to-face interactions. On the second bit of the kind of data that was mostly meaningful, to the participants, to the caregivers and the educators, the data on what their peers in the similar industry are doing was useful to them as they are able to learn more and do continuous improvement. The data on child development milestones assist the caregivers and educators to know the impact that they have on the children's care, as well as the data on the learner's performance, particularly numeracy and language. On the third one, the the burden that has been felt mostly on data collection is that you find some tools are quite limited, and there's need for them to be more customized to adapt to the local contexts in which we operate at. Secondly, they are rigid in administration. You find the questions must be asked in a specific way. They cannot be tweaked. So it becomes hard to deliver the very information, especially to our people whose literacy is a bit limited. That one was also a challenge when it came to translation. You're translating from one language to another, and you're trying again not to lose the meaning and the context of what you're trying to gather. Finally, we also saw that there was risk safety was a bit compromised of the persons collecting the data, because some of the low income setups where you are going to, you find they were very risky and they proved not to be secure. Thank you very much.
Thank you so much for sharing, and thank you everyone for coming today to share about your experiences. And a big thank you to the IRUI team for giving us such a detailed and helpful guide of how you were able to conduct this research and use it to make changes in your program that have ultimately helped you improve your impact. So thank you so much. If you can, please just click on the link in the chat. It's a survey just about your experience today, a couple quick questions. Since we still have 2 more sessions, we would love to be able to incorporate your feedback so that these are as helpful to you as possible. Just as a quick reminder, the next session will be on July 3rd about policy integration and partnerships. So you should have a calendar invite for that, and we would very much look forward to seeing you there. And then we'll be back again on July 17th to talk about building financial sustainability. So once you've filled out the survey, just hope you have a great rest of your day, and thank you again so much for being here. Look forward to seeing you next time.
Thank you,
Thank you,
Sam.
Sarah.
Thank you, Sarah.